Senator Osler.
Thank you, Madam Speaker. My question is for the government representative in the Senate. December 12th is Universal Health Coverage Day, and the 2020 theme is Health for All, Time for Action. On this day, health advocates call for strong, equitable health systems that leave no one behind. A foundational element of universal health care and a high-performing healthcare system is accessible primary care. Yet in April 2023, a national survey found that more than 1 in 5 Canadians, an estimated 6.5 million people, do not have a primary care provider, neither a family doctor nor a nurse practitioner that they see regularly. Senator Gold, apart from the financial contributions to the provincial and territorial jurisdictions, how else is the federal government contributing to advancing primary care in Canada to ensure that no one is left behind?
Senator Gold.
Well, thank you. Yes, in addition to the financial contributions, which are fundamentally important to our system, the federal government exercises a leadership role. I could almost call it a convener role in some sense, and let me give you a few examples. So far, the government has established a coalition for action for health workers to inform immediate and long-term solutions to address the significant challenges that the networks face. It has introduced measures to facilitate the entry of foreign national physicians as permanent residents, and it has invested close to $200 billion under the Working Together plan with provinces and territories, through which the government has asked provinces and territories to streamline foreign credential recognition for internationally educated health professionals. It will continue to work with its partners in the provinces and the territories in that leadership convening role, backed up, of course, by the ongoing federal financial support that the system so desperately needs.
Senator Osler.
Thank you, Senator Gold. How else is the government collaborating with healthcare professionals and stakeholders to identify the root causes of Canada's systemic healthcare problems?
Senator Gold.
Well, in this regard, as you know, colleagues, the government Minister of Health is in regular contact with his counterparts across the country to explore all the different areas, both of needs at the provincial level and also the issues that have risen to national concern. And in that regard, those discussions are the primary vehicle through which new ideas can be generated and new partnerships can be formed.
The question for the government leader is a follow-up to a question Senator Osler asked on Tuesday regarding the poor state of primary health care in Canada. Leader, you responded to Senator Osler that your government exercises a leadership role, or that of a convener. Yet you failed to mention a specific promise the Liberal government made in the 2021 federal election campaign. The Prime Minister promised $3.2 billion to the provinces and territories for hiring 7,500 new family doctors, nurses, and nurse practitioners. It should have started the last fiscal year. Leader, how can you say the Trudeau government exercises a leadership role when there has been no movement on this specific promise to Canadians?
Well, thank you for your question, and it does underline the multiple needs that our healthcare sector experiences, one of which you've referred to, but it's not the only one. Nor is it the only one that the provinces have put on the table subsequent to that campaign promise. Nor is it the only one that is subject of negotiations between the provinces and the federal government, both in the healthcare and more and beyond that. There is an ongoing conversation between the ministers of health and their counterparts, Minister of Health and counterparts across the country, as the priorities of the provinces change, as the federal priorities also evolve, and frankly, as our fiscal capacity becomes clearer. So I do stand by my statement that the Government of Canada does play a lead role in assisting provinces and territories to meet their priorities as they see fit.
Senator Martin.
But, Leader, it's looking to be a failed lead role, as Canadians who don't have access to family doctors will ultimately seek care at a crowded hospital emergency room. And on Tuesday, the wait time to see a doctor at the emergency room in Montfort Hospital here in Ottawa was more than 20 hours. So when will the Trudeau government fulfill its election promise for 7,500 new doctors, nurses, and nurse practitioners?
Senator Gold.
Doctors and nurses are trained in provinces and territories. They are licensed in provinces and territories. We all know in studying this very difficult and complex file that though the money is important, getting the system working properly is even more important. And no matter how much money you throw at a system, if there are not the spots in the universities or the spots in the educational programs and provincial policies have a huge impact, it's not going to work.